The world is facing an unprecedented challenge, a time of grave uncertainty, where the longer-term impact of COVID-19 pandemic will be felt for years to come, even after the immediate shock and response is over. In Asia Pacific, we've been at the forefront of the response since the first outbreak. From the outset of COVID-19 pandemic, UN Women Asia and the Pacific has been working around the clock with governments, civil society, private sector companies, and other UN agencies to make sure that the specific needs and concerns of women and girls are included in the response. For example, in 9 countries in the region, UN Women is supporting governments and UN teams to ensure gender and women's priorities are mainstreamed in the response and recovery efforts. At the regional level, we are co-leading humanitarian groups responding to the pandemic and have led the development of gender-responsive humanitarian briefs that are being widely disseminated and used across the region. We are rolling out a rapid assessment survey on the economic impacts of COVID-19 on women, which is expected to inform our strategies to support women's coping capacities. We are also convening discussions with business leaders across the region to gain their commitment to fast-track gender-responsive action and leadership from the private sector. We are conducting another rapid assessment with women-led civil society organizations to better understand the impact of COVID-19 on these groups and the women they serve. In Nepal, we convened leaders representing women's and excluded groups organizations to identify key emerging issues and jointly advocate the government and the UN team. In Timor-Leste, we are assisting the government to ensure the state of emergency declared incorporates gender and protection considerations. In Vietnam, UN Women and UNICEF are supporting the government to develop codes of conduct and safeguarding measures for women and children in quarantine. In Cox's Bazar, our women's centers continue to provide essential services, including sexual and reproductive health, gender-based violence case management and referral services, psychosocial counseling, as well as awareness-raising activities on hygiene promotion and gender aspects of the coronavirus outbreak. In the Pacific, we are supporting governments to continue gender-based violence programs, including with a focus on COVID-19 risk mitigation. In Myanmar, we will mobilize and equip women-led organizations and networks, particularly Rohingya women, to support the response. Lastly, officers in the region have been leading extraordinary communication campaigns, including in China, Afghanistan, and across the countries to celebrate the role of women as frontline responders, promote safe practices, and support UN-wide advocacy, including a joint campaign with WHO and UNFPA to mark World Health Day in the context of the COVID-19 response. In all our efforts across the region, our officers remain committed to addressing the immediate needs of women and girls, ensuring that we safeguard the development gains made on gender equality and women's empowerment, which becomes even more critical in these challenging times.